Okay, so we're going to talk about the assisting in a root canal therapy. So for your basics, you would need your basic setup tray, which would contain, your mouth mirror, and then, which is this. This is your mouth mirror, which is for indirect vision. And then it will contain your Explorer, which detects like decay and all that. And then here's your cotton pliers, which the cotton pliers are used to have like cotton go in and out of the mouth without trying to hurt the patient or things like that. And then you'll need the local anesthetic agent setup. It's optional. The dental dam setup, the high-speed handpiece with burrs, low-speed handpiece, with latch attachment, 5 to 6 millimeter syringe with a 27 gauge needle, a brooches and hemostorm, K-type file, assorted sizes, and then you'll need your rubber instrument stoppers, paper points, gutta perchas, endodontic sealer supplies, endodontic spoon excavator, endodontic explorer, your glitch number 1, and then you'll need your lentil spiral, the millimeter ruler, a locking cotton pliers, a sodium hydrochloride solution, and then your hemostat, and then your high volume oral evacuator, which is your HVE tip. And then you would have to prepare the tooth. Make sure that you give the patient the local anesthetic, and then you would have to make sure that you put the dental dam, swab the anesthetic solution over the exposed tooth, and then clamp and the surrounding dental dam. Okay, and then you would have to, the dentist will enter the canal portion of the tooth with a carbide round burr to remove the decay. And then you would have to do the canal would have to be irrigated gently with an irrigation solution. Excess solution is removed with the HVE tip. The dentist uses a small endodontic file to rub the irrigation solution against the walls of the canal and pulp chamber. And then you would have to, for the cleaning and shaping the canal, the dentist will use a series of files beginning with the smallest and working to the largest as needed. The files are placed into the canal and removed up and down with short strokes, and then you would have to transfer large files to the dentist to clean and shape the canals. The rubber stop must be placed on the file at the desired working length for each canal. And then you would have to irrigate the canal thoroughly and frequently during the shaping and cleaning process. And then you would transfer the paper points for restoration into the canals until the points come out dry, because you have to make sure that it's dry. You cannot have it wet or anything like that. And then preparing to fill the canal, you would have to select appropriately sized gutta percha point and cut it to the pre-dimented length. This is called the trial point. Take a preapical radiograph. So then they would have to take a preapical radiograph of the tooth trial to make sure that the point in the it's called a trial point in the canal. This is the working length radiograph. If the radiograph does not show the tip of the trial point within 1 millimeter of the apex of the root, the point is repositioned and another radiograph is taken. And then after the single from the dentist, prepare a thin mix of sealer on a sterile glass slab. So basically with most procedures you'll use a glass slab. With some procedures you'll use a paper slab, but specifically for this procedure you're going to use a glass slab to mix the material. And then the master cone is removed from the canal, coated with sealer and resorted by the dentist. So technically that part has to be done by the dentist. It cannot be done by us assistants, technically, because we are not licensed to do that. And then you continue transferring the gutta percha points to fill the canal. And then you get a glick number 1. You have to make sure that it's heated at the working end to remove the excess of the gutta percha. And then you transfer the plugger for the dentist to compact vertically. This routine continues until the canal is completely filled. The dentist places a temporary restoration. So for this particular procedure, they technically place a temporary restoration until the next appointment, and then they'll be able to place a permanent restoration. And then you would expose a post-treatment radiograph. The dentist checks the occlusion and adjusts as needed. So you always have to make sure that the occlusion is right on point, because you cannot have it high, you cannot have it too low, or else the dentist will have to adjust it. And then after everything is done, the treatment's done and everything, then you give them their post treatment instructions and follow-up, and then you give them a date when they can come back for another follow-up.